Hi, I'm Jeannie and welcome to this episode of Your 5 a Day. Today we're looking at hips and low back. So remember to adjust these exercises or omit any of the exercises if they're not suitable for you right now. So let's get started. We're going to be lying down on our back. If you need a cushion for your head, please grab one. And we don't need any equipment for this set of 5. So let's take a few moments to just settle into the floor. You can of course do this on your bed as well. And just take a little breath in and a long breath out. Just let the breath come and go, and allowing the spine to drop into the floor. Starting to pay attention to the muscles around the pelvis, letting them be heavy into the ground. So we're going to start with some lovely pelvic rolls. So I'm just going to move my hands so you can see my pelvis, which is here. So we're going to inhale, gently let the pelvis be tipped forward. As we exhale, the exhale draws the pelvis back to the floor and the lower back flattens. So we inhale. Notice how the body gets rounder and expands, and we exhale back down. So what I'm not doing is forcing. Can you do this with hardly any muscular effort? Notice how the rest of the body might be moving. Your ribs might lift. You might feel your head being drawn down. Your head might be lifted back up as you send the back flat into the ground. One more time. So a really nice way to softly start to mobilize the pelvis. Come back to where your pelvis can rest, and we move on to a supine rotation. So hands can come out on the floor a little bit wider, and we can start just gently rocking, again with hardly any muscular effort, the pelvis from side to side. So we start to mobilize the low back, but also we get a bit of rotation at the hip joint. Now as you get more confident, and if it doesn't cause pain, you can obviously start to go a little bit bigger. But what I don't want you to do is allow gravity to drop your legs to the floor, which would look like this, where I drop to the floor and just collapse. Okay, so try and keep it smooth. Make sure the shoulders stay heavy. That's going to determine how far you go. So I'm not going to push myself if my shoulders are coming off the ground. Use your breath to roll from side to side. Nice and slow, nice and gentle. Just notice the rotation that's going on through the hip joints. And we come back to the center and we really rest. So we take a breath. And we let the weight of the pelvis drop into the ground. So almost feel your pelvis spreading out across your mat or across your bed. Move your feet a little bit closer towards your pelvis, hands by your sides. You may want to remove your cushion at this point because we're going to do a little baby bridge. So find your feet, take a breath. We go back to that little pelvic tilt that we did earlier, but then I start to stand into my feet. Let the feet open into the ground to float the pelvis off the floor. And I might just stop here and just take a breath. Make sure the belly is nice and soft. Again, as we exhale, soften, releasing the weight of the pelvis down into the ground. Shoulders stay heavy, head stays heavy. So we stand into the feet first, allowing the pelvis to roll, and we start to float up. Again, if you experience any kind of pain, just keep it lower. Some of us might be starting down here with a little pelvic hover. Some of us might be going up, allowing the rotation of the ribs to get us into a higher bridge. But at no point do we push and really hyper tighten the lower back. So it's not about how high you go, It's whether we can stand heavy in our feet and let the spine have some freedom. Let's just do one more. We stand into our feet. Lovely for opening the hips. So if you've got tight quads, tight hip flexors, fantastic for strengthening the back of the legs. But we're not squeezing the back of the legs. The back of the legs are going to work anyway. And then we're going to roll it back down. From there, I'm going to take one leg away long, and we're just going to hug one leg into the chest. So this is very nice for releasing low back pain, allowing the two halves of the pelvis to move in opposite directions. And we'll just do a couple of ankle circles while we're here, because that feels really nice too. So again, feel that weight of the pelvis into the floor. Let your breath settle. Before you release that leg, slide it away and let the other one join you. So try not to grasp onto the kneecap itself, either do behind the leg or on top of the shin. And it might feel different one side to the other. So just notice that. And see if you can breathe and release. Really let this leg get longer as you hug the other leg into the chest. Really lovely exercise. And then we're going to slide the other leg back in. Now what I quite like to do if I've got very tight hips and low back is I bring both legs in. And so I hug both in. So my tail is now lifted off the mat. So my lumbar spine is going into flexion. And then I start to stir the knees. So I open the legs and I circle down and around. So supported knee circles is our exercise number 5. So all of these exercises that can be done on the bed, no weight bearing required. So it's nice and gentle on all the joints. And let's reverse our knee circles. So we go out. And again, I'm not pulling. Notice I'm not pulling strongly on the arms. I'm really thinking about massaging into the hip joint. Using my breath. One more time. And then we'll just finish our 5 a day with a little hug. A cleansing breath. A relaxing breath, and let the lower back just release before you lower yourself back down to the ground. Make your way up slowly. When you're ready, you can of course stay there doing some lovely breathing work. So that was your first 5 a day for hips and low back. I hope you found that useful. Leave me some comments in the box below. And until next time, stay zebra strong.